Hello everyone, I'm Catherine Harwood and I'm a consultant dermatologist based in London.
And I'm Agata Rempiela, clinical oncologist based in Manchester. We are the co-chief investigators of the SCC after trial.
And I'm Lucy Wallace, a researcher at the University of Bristol and part of the QRI and Inclusion Swap team for SCC After.
And in this video, we're going to talk about the QRI and Inclusion Swap or information study and why it's so important for SCC After. So what is this study? Well, the QRI and Inclusion Swap, or information study as it's called in all our patient-facing materials, is integrated within SCC After. For those who haven't heard of a QRI, this stands for Quintet Recruitment Intervention, which is an intervention used within RCTs with the aim of optimizing recruitment and informed consent. The inclusion swap, and swap stands for study within a project, is embedded within SCC After, and it's emphasising on including people who are less likely to be recruited to clinical trials, for example, older people and those living with other health conditions, including cognitive impairment. And this is important because research studies should ideally reflect the patient groups we see in clinical practice. The information study isn't a sub-study, it's fully integrated within SCC After. Much of the information study data collection will not be obvious to site teams involved in SCC After. It spans everything from how eligibility criteria are applied, monitoring who is screened and recruited, right through to how SCC After is presented to eligible patients.
So what does the information study look like in SCC After? Some of these may look familiar, for example, routine screening log data. But there are also specific data collection activities which are likely less familiar. For example, taking part in audio recording recruitment discussions with patients, inviting patients to take part in interviews, or taking part in interviews. Patients or recruiters can decline to take part in one or all of these. We understand colleagues' concerns about these when they are unfamiliar, but the information study processes are designed to be integrated within the trial and not too onerous for our clinical colleagues. So why is the information study important for SCC After? We know that patients want to participate in research, and how information is conveyed and informed consent is key to recruitment. Recruitment to randomized control trials is challenging, and this is likely to be the case for SCC After, involving possible complex recruitment pathways. Monitoring who is screened and recruited to SCC After will be crucial in understanding if SCC After is being inclusive. Understanding how the trial is being presented to patients through audio recording discussions will allow for sharing of best practice with recruiters at other sites to help optimize recruitment for the trial. Finally, taking part in an interview will allow for exploring the recruitment pathway and sharing any recruitment obstacles. Best practice from across different sites can then be shared to try to address these.
Thank you for listening. You can find more detail on the information study in the pre-recorded SIV videos, which are located on the online video sharing platform, which will be shared with sites before their SIV. If you have any questions about the information study, please do not hesitate to contact me, Lucy Wallace, or Julia Wade, or Vicky Shepherd. Thank you.